Hi, we're back. We're going to talk about autism spectrum disorder. So, what is autism spectrum disorder? Well, commonly known as ASD is a developmental disability that can cause significant social, communication, and behavioral challenges. There's often nothing about how that person with ASD looks like that would indicate that they have this disability, but they do struggle to read social cues and to communicate and to master language, which can really hamper their ability to be successful in school and successful in work. So, we're going to watch a brief video about what is autism.
Hi there, I am Wally. You may be wondering what I'm doing here. Well, let me start again. I am Wally and I am autistic. For those of you who are not familiar with this term, autistic is a person who suffers from a neurobehavioral condition called autism. But what exactly is autism? Well, it can be a tricky question because autism can be a lot of things. This condition is now being referred to as autism spectrum dysfunction because of its variety and diversity of symptoms. Quite possibly, my autism may be different from another autistic, and that his or her autism may also be different from another autistic, and so on. However, there are three basic symptoms that are observed in all types of autism. Social interaction challenges, deviant responsiveness and difficulty in communication, cognitive dysfunction and insensitivity or oversensitivity to certain stimuli including sight, hearing, smell, taste and touch, tendency to engage in repetitive behaviour throughout life on a daily basis. It may involve pacing, head rocking and hand flipping, etc. Now, let me evaluate myself according to these symptoms. I've never felt comfortable in social circles. I don't go out with friends or in gatherings, even though I have nothing else to do, and usually I feel out of place and panic in social gatherings. So, first symptom, check. I have trouble assessing how my words or actions will affect the other person psychologically. I have a really bad reputation for being blunt, and quite frankly, I have no idea why my words can hurt people. Most people tell me that I don't respond when I'm spoken to. I know that they're talking to me, but I feel a lot of background noise, which makes it hard for me to focus on one point during conversations with multiple stimuli involved. Along with that, sometimes I cannot assess the hidden meanings in conversations. For example, if I'm asked to take my seat, I would pick up my seat and ask, where to? So, second symptom, check. Since my childhood, I have a strong tendency for head rocking side to side. It calms me down. I have these episodes daily and quite often multiple times in the same day. So third symptom, big check. Enough about me. Let's go through some important facts about autism. Autism is known to affect 1 in every 60 individuals, with boys at 5 times more risk to be autistic than girls. Quick question. Do you think the dominance of autism in males has something to do with their gender, more specifically with the Y chromosome? What causes autism is still unknown. It is believed that a cocktail of genetic, environmental, and psychological factors contributes towards autism. Autism is broadly divided into 3 major types. Classical or Kanner's autism, often referred to as severe autism. This type usually covers the low-functioning autism. In this case, autistics have the same but more severe symptoms, along with certain other developmental disorders. A very low IQ, loss of cognition, speech, antisocial behaviours and mental retardation in extreme cases. Asperger's syndrome, also called as high-function autism, tends to have the basic symptoms but with low severity, so that the individuals suffering from it have a very good chance of a normal life. Asperger's syndrome has known to be associated with high levels of IQ, with individuals that may lag in certain daily races of life, but are super smart at stuff that appears to be very difficult for smart but non-autistic individuals. These excellency may include problems in science, art, math and music, to name a few. Can you imagine someone who got the highest score into SATs twice, but can't ride a bicycle properly and gets confused in easy tasks, like opening a push or pull door. The third type, also known as pervasive development disorder, or atypical autism, it usually involves more sociological and behavioural associated deviations, and is a rather less studied type of autism.
Okay, so now we'll move on to some of the challenges and symptoms of autism and some of the strengths that people who live with autism have. So some of the symptoms and challenges that people with autism syndrome face are a difficulty in understanding how other people feel, having trouble understanding other people's feelings or talking about their own feelings, prefer not to be held or cuddled, being very interested in people but not knowing how to talk or play with them, repeats actions over and over again. They have trouble adapting to change. They often have a unique response to sensory stimuli, the way things smell, taste, look, feel, or sound. So some of the strengths that people with ASD have include they have a high attention to detail, often high skills in a particular area. They tend to be very technology inclined or musically inclined. They're less concerned about what other people think about them. They're independent thinkers. They often have they're often able to see the big picture. They're very good at being non-judgmental, and they're also really good at making decisions. Because they don't put a lot of emotion into the decisions that they do make. They tend to be very honest, and again, they tend to not be very judgmental, which those are all really wonderful strengths. If you can get past some of the nuances and oddities that people with ASD have, they have a wealth of strengths to offer people and to offer friends. How is autism diagnosed? The American Academy for Pediatrics recommends that all children be screened for autism at their 18th and 24th month well baby checkup. So early detections are very important. This diagnosis is typically made by a doctor. But a child psychologist can also do a diagnosis for autism. Autism is a very odd thing. A lot of times, small children do not have symptoms of autism. And so, the onset of autism can be very quick, where a small child may be progressing with developmental milestones and then all of a sudden stop communicating, stop talking, which is very jarring and unusual for parents because your child was on a path and a trajectory that made sense, and then all of a sudden things started changing kind of out of nowhere. So it's very important when you take your child to the doctor at their 18th and 24th month that they be screened for autism, even if you don't see any early indicators. It's also really important when you do start to see some of the symptoms, which is like a speech delay, not wanting to be held or touched, an inability to sleep at night. A lot of times they have digestive issues. That you communicate all of this with your pediatrician and your doctor so that they have a full range, like a full scope image of what's happening with this child. The film referenced that some autistic people, which are considered very low functioning, will also be coupled with intellectual disabilities. So we find that exists. 1 in 59 children live with these dual diagnoses. But the other statistic, which is pretty broad and actually came out through the CDC, is that 1 in 60 children are diagnosed with autism. As mentioned in the film that we watched, in 2020, the CDC report found that 1 in 54 children, so it ranges between 60 to 54 children are diagnosed with ASD. 1 in 35 boys are diagnosed with ASD, and 1 in 144 girls are diagnosed. So it is more dominant in boys than in girls. So the treatments for autism, there are a number of really well-developed treatments. However, the most important thing is early intervention, which is why in foster care, foster parents and kinship parents need to be armed with this information, because you all can make the biggest difference in that child's ability to have a successful life, right? So early intervention is critical. And so, if they can get diagnosed and begin treatment right away, their outcome is going to be pretty high in terms of being able to be successful. Behavior modification therapy, cognitive behavioral therapy, early intervention, education and school-based interventions. So other treatments that children with autism have is medical treatment. So there is medication to help children with autism. Nutrition has been found. So like a certain diet, there are a number of different diets that children with autism that people have found really help them with their symptoms. Occupational therapy is also extremely important, because a lot of times children with autism struggle with gross motor and fine motor skills. And speech is one of the big things that needs to be addressed early on to keep children with autism continuing to be engaged. So that concludes our overview of autism, and now we're going to move on to Tourette's syndrome. So what is Tourette's syndrome? Tourette's syndrome has been around for a very long time. It was originally identified and diagnosed in the early 1800s by Mr. Tourette. He called this diagnosis after his last name. It's a neurological disability. It occurs in children. In a lot of cases, people outgrow Tourette's. It has to do with two primary functions. There is involuntary tics. So these are body tics that people cannot control. There's verbal and nonverbal body tics. So we're going to watch a video on what is Tourette's syndrome.
Tourette's syndrome is a medical condition that people live with in their daily lives. They make involuntary sounds known as tics. It could be a sound or a movement that the body cannot control.
I have this one. Sometimes I click my tongue in the back of my throat like this, but not very often, and I constantly crack my knuckles, even if I already did.
So they mostly would ask me like why my eyes keep twitching, or asking me if like if I can stop like moving my leg.
The tics were more like the head shaking as well, barking. I had a tic for a while where I'd step backwards and walk backwards for a couple of steps and then walk back. I had a tic once when I'd be standing and I'd lift up my leg.
When I was first diagnosed, I was out of school for weeks. My tics were very high. My vocal tics were elevated. My motor tics would really hurt me. It was tough.
7 or so years old, I was responding, well, is this just gonna keep on?
I was younger, they like singled me out and treated me more as, as basically almost as if I was like an alien in a sense. And because at that point in time, I didn't really understand much about what was happening.
We have a 7-year-old. When I take him to school and I go down the elevator, right before we get on the elevator, I'll take my teeth and I'll bang my teeth against the wall. And he asked me, "What are you doing, Dad?" So I said, "Oh, I have Tourette's syndrome. It's a condition that causes me to do things I don't want to do." And so the funny thing is, the other day he comes up to me, we're standing there and I don't do it on the elevator. And he says, "Daddy, you didn't do your Tourette's." And I'm like, "No, it's not like that. It doesn't work that way."
It's hard to suppress a tic, and even if you do suppress a tic, when you're done suppressing the tic, they only come out more.
I have to morph my words. Instead of saying bomb, 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 I go bop or abba.
If I try to suppress them, it doesn't work. That's like trying to hold in a sneeze.
Young girls would laugh. Kind of embarrassing for an adult to be bullied by young teenagers.
As a young kid, I would take whatever it was and immediately look around to see who noticed, like as if it really mattered.
And then you really start to believe that you are different.
I would be out on the subway and attracting attention from other people, adults, and like learning about how cruel people can be. Seeing those kids in DC at the conference treating their tics as something that was just part of who they are was so inspiring.
It's really cool. Kids don't get judged there, and they have fun with other kids like them.
Other than our tics, we're normal people, because everyone has their own things that make them different from one another. And Tourette's syndrome, this happens to be one of those things for some people.
Don't be afraid of people with disabilities. Just because someone has a disability doesn't mean that you have to avoid them.
I think the Tourette Association of America means support and community.
My hope is that everyone who sees this video goes home and tells 3 people about Tourette syndrome.
Okay. So that was a wonderful video by people living with Tourette's syndrome. Like I said before, this is a disability that has been around for a very long time. People with Tourette's cannot help themselves when they have their tics. And as I'm sure you saw in the video, and maybe you've known somebody with Tourette's, for them, socially, it can be extremely challenging. So next we're going to look at what are the symptoms and challenges that face people with Tourette's, and what are some of the strengths that people who have this disability have. So some of the symptoms and challenges that people have with Tourette's are motor tics, which are sudden movements of the body, vocal tics, such as throat clearing or humming. Complex motor tics can be jumping, touching others, harming oneself, biting or hitting oneself, or rarely other people. I think it's mostly done to oneself. Complex verbal tics can include swearing or yelling very loud. Many children with Tourette's also have other diagnoses, and this is actually important to recognize, such as attention deficit disorder, and a big one that a lot of people have is obsessive compulsive disorder. So this kind of repetitive obsessive need to control their environment is often coupled with Tourette's syndrome. Many of the strengths of people who have Tourette's syndrome include a tendency or an ability to be creative, very engaging, successful and quick at completing things that they really enjoy. Often people with Tourette's have a good sense of humor. I've seen comedians with Tourette's. They also have a propensity for being very empathetic. Like I said, Tourette's occurs in childhood. For some people, they do outgrow this disorder. For others, they don't. It continues into adulthood. And because of the nature of their disability, they understand what it feels like to be on the outside, what it feels like to be judged and made fun of. So they have a tendency, because of that experience, because of their resiliency, they have a tendency to be very empathetic. So how is Tourette's diagnosed? Doctors will look for these signs of Tourette's. The existence of both motor and vocal tics, tics that occurs regularly for at least a year, tics that start before the age of 18, tics that change over time, and tics that don't have other causes. So one of the things that happens with children who have Tourette's is that these tics will emerge in childhood, and you would go to your pediatrician or your primary care doctor to get this diagnosis. And one of the first things that they will do is that they're going to rule out a bunch of other things before they narrow in on a diagnosis of Tourette's, because sometimes tics can be reflective of like a brain tumor, for example. So they usually give a physical exam, they'll do blood work, and they'll often do an MRI or CT scan to look for tumors and other things that could be happening inside the body that might be causing some of these tics. Once they've ruled out that the body doesn't have any of these signs or symptoms or any of these kind of really scary diagnoses, then they will hone in on the frequency and the amount of time that these tics have been going on to actually come up with a diagnosis of Tourette's. 1 out of every 100 children between the ages of 5 and 17 have Tourette's or another tic disorder. Rates of Tourette's in children in the US. Usually tics start between the ages of 5 and 7, and they peak around the ages of 8 to 12. By early childhood, the severity of these tics should be paid attention to, and the doctor should do an evaluation and kind of rule out other things like this, like the previous slide said. A lot of times children grow out of Tourette syndrome, but sometimes they don't. Rates of Tourette's in U.S. children. So childhood Tourette symptoms is 3 to 4 times more frequent in boys than in girls. So there are some treatments out there to help people with Tourette's, and I thought I would show this video of a doctor explaining the 2 primary treatments that people are using to help children who have Tourette syndrome. One is a kind of behavioral therapy, which helps people identify a tic before it comes on. Like some of the people said in the video, Tourette's feels like a sneeze, like it's very hard to control. Although you can suppress a sneeze, it doesn't mean it goes away. And that is true for tics as well. The other thing that happens for a lot of kids is that when they are consumed with trying to suppress all of their tics, their entire brain is occupied doing this, and therefore they have no time left in their brain. They have no brain space left to be like learning, for example. The other primary treatment is medication. And there's a couple of different medications that they use. These medications were developed for other things such as schizophrenia and blood pressure, but I'll let the doctor explain this.
In the world of
treating tics, medication and recently behavioral interventions have been shown to be effective. Let me talk about the medications first. In the world of medication treatments for Tourette, there are two main classes that have been used and studied, and they are medicines that began their careers as blood pressure medications. These are medications that have a subtle effect on a particular brain chemical called norepinephrine in the brain. And these medications turn that system down just a bit, and in some cases can have a beneficial effect on tics. I would say about half the children treated with one of these medications, clonidine or guanfacine, will show some benefit. The other major group of medications that have been used in Tourette syndrome are the so-called antipsychotic medications. And these are medications that were developed for the treatment of schizophrenia, hence the term antipsychotic. And these medications work by blocking another chemical in the brain called dopamine. And these medications are reliably quite effective, but they do have adverse effects that make us pause because the medications have not been all we would like them to be. We have also been very interested in alternative approaches, particularly behavioral interventions. Many individuals with Tourette syndrome will tell you that they have a feeling or an urge or a sensation before their tic. They view that sensation, they view that warning as unpleasant. So what we use in habit reversal, we exploit that premonitory urge. We exploit the idea that that actually is a signal that the tic is about to happen. And we try to train the person to become as acutely aware of that premonitory urge early, and then to mount a behavior that is incompatible with the tic. So if a person has a head-jerking tic in response to a premonitory urge in their shoulder, we might tell them to move their head down and hold their chin to the midline. If they're doing that, they can't jerk their head to the side. And the idea is that the premonitory urge will pass. That's the simple-minded idea of habit reversal. Does it work? We now have 2 studies to show that it works. The effect, the magnitude of benefit is not as good as our best medications, but as I mentioned previously, our best medications also have adverse effects.
Okay. So just to go back and finish up Tourette's, the last thing that I would say about this disability is that there is a movement within that community, which is a small community of people, to really stray away from needing to control tics and really create a culture of inclusion and acceptance, which is to say, I have Tourette syndrome. I can't help it. I don't want to take a psychotropic medication or blood pressure medication to control my tics, or nor do I want to spend my whole day trying to control these tics. I would like the world around me to be more accepting, so that we don't have to spend any time on my tics. This is a wonderfully empowering concept and really speaks to creating an environment in a home life and at school where children are accepted for who they are and not judged for things that they can't control. So all of the disabilities that we've talked about in this class all fall under Americans with the Disability Act. So this is a civil rights law that was passed originally in the 1970s. This law protects people with disabilities and provides equal access to public life, which includes jobs, schools, transportation, and so when this law passed, which was hard fought by people with disabilities, it ensured that children with disabilities had equal access to schools, had equal access to transportation, and equal access to employment. In 2008, the Americans with Disability Act was actually broadened. And so this really talks about how they broadened the law, which was wonderful. Unfortunately, under our current administration, under Donald Trump and his administration, they have been steadily trying to chip away at this law and defund certain services that exist to help people with disabilities and to help children with disabilities in schools. So, how to support youth with neurodiversity in foster care? While studies have ensured that 30 to 40% of children and youth with disabilities in foster care may qualify for special education services, for a number of reasons, only 16% may actually receive the full array of services that they are entitled to through individual education plans. And I can't stress how important this is. If you have a child in your home who has a disability, any of the ones that I've discussed in this training or other disabilities, they have a right to have equal access to education. And, you know, individual education plans are complicated. They're designed to be complicated. There's a lot of legal language in those documents. There are wonderful nonprofits that exist to help parents and foster parents advocate for children so that their IEPs are being fully followed, or that their IEPs reflect everything that the child needs. So, how to support youth with neurodiversity in foster care? One of the most important things that you can do is to become an advocate. Become knowledgeable of your child's disability, advocate for access in schools, and get connected with an advocacy support group. So there are nonprofits for people with dyslexia. There are nonprofits for people with Tourette's. There are nonprofits for people with autism. And there are nonprofits for people with ADHD. There are also nonprofits for people with hearing and visual impairments. These organizations exist to help advocate for people who are needing equal access. Get connected to these organizations. If you don't know where to find this information, talk to your case manager. They can help you find this information. It will be, they will have websites online that you can get connected to, and most nonprofits have chapters in local areas such as Philadelphia or Montgomery County, outside of the city of Pennsylvania, outside of the city of Philadelphia. So what is an individual education plan? So kids with different disabilities who qualify. So after they have had a psychological evaluation, or after they have had a diagnosis from a doctor, they are eligible for accommodations in the school setting. These accommodations also often look like individual education plans. These plans are supposed to be written to address the deficits that child is facing and to provide them with accommodations so that they can be successful. Understanding how to access these services can help parents to effectively advocate for children. But like I said before, these documents, are very complicated. They can be difficult to understand. Which is why it is really important that parents and foster parents and kinship parents need to have advocates with them. They don't have to be an attorney, but, fortunately for our children in foster care, they all have child advocates, and I certainly would engage a child advocate in this process. Even though their expertise may not be in IEPs, they know how to argue and advocate for a child legally. And the minute you bring an attorney to a school district meeting, the school district starts taking you seriously, especially if your child has a disability. So connect with your child advocate, connect with nonprofits that specialize in certain disabilities. Show them the IEP that's been written by the school. Have them walk you through it so that you understand what they are offering your child, and you understand if it is truly meeting your child's needs. You also, once you have this document in place, you need to revisit and make sure that they are actually doing what they said they were going to be doing. So this is as a parent and a resource parent, a kinship parent, this is a high level of commitment to really stay on top of your child's educational needs and make sure that they're getting their needs met. So who needs an IEP? Well, all of these kids that have these diagnoses deserve an IEP under the Americans with Disability Act. So learning disabilities, which include dyslexia, dysgraphia, dysnomia, attention deficit disorder, that is what falls under learning disabilities. So I just want to take a minute to explain the difference between a learning disability and an intellectual disability. An intellectual disability reflects somebody who has mental retardation. A learning disability are kids that struggle to learn because they have different disabilities such as dyslexia. They are distinctly different and should not be assumed to be the same things at all. Emotional disability, attention deficit hyperactivity, autism, hearing impairment, developmental delays, which is intellectual disability, visual impairments, speech or language impairments, and physical disabilities. All of these children who have a diagnosis with one of these absolutely should have an individual educational plan. So this concludes our training for today. Thank you for watching this video. If you have any questions, please don't hesitate to reach out to your case manager so that you can develop a plan that makes most sense for you, your child, and your family. Arm yourself with education and recognize that your child may have a difference, but they also have wonderful strengths, and they're resilient. And just like a superhero, they just need people to believe in them, and they will be incredible adults. But you have to understand what they're up against. I thank you for participating in today's class.